Hi class, my name is Dr. Kennedy Paron, and today we will be going over Chapter 2, Section 2, Chromosomal and Genetic Abnormalities. So first, we'll be starting out by talking about Down syndrome. Down syndrome is a syndrome that impacts the 47th, the 21st pair of chromosomes, making them have 3 different chromosomes on the 21st pair, making the child have 47 chromosomes when conceived in utero. The older the parents are, typically the mother especially, the greater the chance of having a child with this syndrome is. So what exactly is a syndrome? So a syndrome is something that has characteristics that come together to be present when somebody has a certain type of condition. For example, when somebody has Down syndrome, they typically have a round face, a tongue that sticks out and protrudes, especially when speaking, skin over the corners of their eyelids, and a large flattened nose. There are also sex-linked chromosome abnormalities, such as having 2 Y chromosomes, and this happens in 1 in every 700 to 1,000 men, having an extra Y chromosome. These are abnormalities that are given generation to generation in families, carried on the sex chromosomes, usually on the X chromosome typically. Several disorders can be sex-linked in nature, and many actually cause infertility, unfortunately, when people have them. So there are a few different types of genetic abnormalities discussed by the textbook. So the first is going to be phenylketonuria. This is a genetic abnormality in which this substance builds up and causes intellectual disability. This is an enzyme disorder, so the enzyme is overproduced. So this is actually a recessive gene, so it is not a dominant trait that is passed down. And it is in 1 in every 8,000 children that have this condition. This child has difficulty metabolizing amino acids. So half of the children with this genetic mutation actually do not have the full disease due to how it is passed down. Next, we will be talking about Huntington's disease. Unfortunately, this is a fatal condition. It's a neurological disorder, and you do not typically know you have this until you are middle-aged. This is, however, a dominant trait. This is degenerative and progressive in nature. So once you do have this disease and it is onset, unfortunately, it progresses quickly, and you do unfortunately pass away from it. This is characterized typically by uncontrollable muscle spasms and movements. So we're going to talk about a few more different genetic abnormalities. First, we'll be talking about sickle cell anemia. So this is a genetic disorder that decreases the capacity of blood to carry oxygen. It is typical of people who are African American. 1 in 10 or 10% of people who are African American do have this disease. Next, we'll talk about Tay-Sachs disease. This is a fatal genetic neurological disorder, much like Huntington's disease, in which nerves in the brain cells and spinal cord are progressively destroyed. So this is a very painful disease. Next, we will cover cystic fibrosis, which is covered in the textbook. Again, this is another disease that is fatal, and it is a genetic disorder. Unfortunately, we do not have a cure for it right now. This is where the mucus is thicker in the lungs and obstructs the lungs and pancreas. Roughly 30,000 Americans suffer from this disease currently. So now we're going to talk about genetic versus chromosomal abnormalities. We can use science to predict genetic abnormalities. However, we are unsure sometimes how they progress and how they are passed down. Genetics are definitely linked to many of diseases. There are hundreds that we can link back to genetics and passing down. There are professionals called genetic counselors, in which people who are of childbearing age and want to have children can talk to a genetic counselor about the probability of passing down a certain disease, especially if somebody in their family has it or their partner's family has it. Some patients visit genetic counselors and end up adopting because they do not like the odds of passing down a disease that somebody in their family or themselves have. There's also what's called prenatal testing, and this can be done in order to test some genetic abnormalities that occur in fetuses. There can also be blood testing of parents, and this can help to see if there are genetic abnormalities present in recessive genes. So this would mean the parents do not show symptoms or signs of these diseases. However, they are running in the family. So next we're going to talk about ultrasounds and sonograms. So think about this. So the military uses sonar oftentimes to help them locate submarines of their enemies. So similarly, we can use ultrasounds and sonograms to help us see fetuses in the utero, in the fluid in the utero. So what exactly is an ultrasound? So an ultrasound uses waves that are too high pitch for the human ear to hear. However, they bounce off the fetus in utero, and we are able to get an image like this. A sonogram is a picture that is constructed by ultrasound waves and provides an image of the embryo or fetus for the mom or dad to see. So there's also invasive testing. There's what's called an amniocentesis, and this is the process of drawing out fetal cells from fluid in the amniotic fluid to determine whether there are disorders present in the fetus. This is usually performed between 14 and 16 weeks of gestation. And in the past, this type of testing could be standard if the mother is above 35 years of age to predict the amount of risk that the mother or fetus would have. Next, we will be going on to Chapter 2, Section 3.